Hey everyone, welcome to Facebook Live. I'm Dr. Mary Ellen Shannon from the Center of New Medicine. I'm going to give you a little bit of insight on breast cancer and new technologies and the way to treat that. I do have some patients here in front of me, so I'll address questions on Facebook and also from the people that are in the audience. My background is OBGYN. I practiced OBGYN for 20 years before coming to the Center of New Medicine. My conventional training was abruptly ended because I got sick myself. And I got sick because I randomly took prenatal vitamins and vitamin C. Who would ever think someone could get sick by taking prenatal vitamins randomly? I came down with arthritis and fatigue, and I thought, you know, being a doctor, I thought I'd treat myself with, and I thought that made a lot of sense. Hey, that will pep my energy up. These got to be good. I can hand them out every day, right? Wrong. Yeah, what happened was my symptoms got much worse and I almost died because I have a genetic disease called hemochromatosis, and I had a delayed diagnosis, and hemochromatosis causes me to absorb too much iron. So I went into multi-organ failure. Mayo wanted to do a heart and liver transplant, and they said if I don't do that, I'll die in 2 years. So for everybody here and for everyone out in Facebook, you need to be your own advocate. You need to start learning. You need to step outside the box. There's many ways to treat things that are not being revealed to you. So thank God I had the background of being a nurse and also of my medical education, because I would be dead right now. If I listened to the Mayo doctors, my quality of life of doing a heart-liver transplant would not be the way I am today. So I can tell you, first of all, I have so much I've learned through my journey. Number one, be your own advocate. Research. Look around. There's a lot of other things. So when I thought the heart-liver transplant was not the option for me, I began to go back to the basics. How do I rebuild my damaged body? What do I do? How do I get this iron out of me? Well, in my case, I had to phlebotomize myself, remove blood, make myself extremely anemic so that the iron would come out of my organs. And right away, the first thing I did when I got out of ICU is I went home and I mapped out what medications, all the medications I was sent home with, and saw how they disrupted normal biochemistry. It's basic. I take a medication and then I take another medication down here because that disrupted this pathway, and there's a side effect here, and I'm like, oh my God, these medications are killing me. So what I did was I consulted an integrative cardiologist and gradually weaned myself off these medications with his help and replaced them with supplements that work synergistically with your body. But of course you should take vitamins and supplements by being tested to find out what you're deficient in. Don't randomly take vitamins like I did and almost died. So I advocate doing that, and I've stepped outside the box and found other ways to regenerate and replace my all the damage that the excessive iron did. So I think Dr. Keneally, my mentor, kind of explains cancer, any chronic illness like I had, as a boat with tons of different holes in it. You can't just approach a chronic disease by plugging up one hole. The ship's still going to sink. So you got to look at it holistically. You got to look at the whole body. You just don't focus on treating the breast cancer, because why'd you get it to begin with? You know, are you metabolizing down the wrong pathway? I was just explaining here to people in the audience that some people have a genetic problem where they don't metabolize down the right pathway. There's 4 pathways you can metabolize your estrogen. You can go down the 2-hydroxy pathway, that's what you want. Or you can go down a 4-hydroxy pathway that leads to cancer. So you can help prevent going down that pathway by eating cruciferous vegetables. But if you don't like eating cruciferous vegetables, there's a supplement called DIM, or I3C, that can help you metabolize down the right pathway to the 2-hydroxy pathway. I'm so grateful because of my genetic disease. I tested my daughter, both my kids. And my daughter so happened to have a double meaning 2 different abnormal genes in the metabolization of her estrogen. She was metabolizing down potentially the wrong pathway, and if she went on not knowing this, she could get cancer in a very early age. Since I've been practicing OBGYN and coming to the Center of New Medicine, I've definitely seen a huge rise in hormone-dependent cancers. And that's because our environment is toxic. There's a lot of xenoestrogens. Xenoestrogens are chemicals that are around us that hook on the estrogen receptor and turn it on, and causes us to have an overabundance of estrogen. So I think anybody, you need to pay attention to what you put in on your skin, your cosmetics. You know, I'm from Arizona. A lot of people would keep plastic water bottles in their car, and it heat up, and then you get the BPAs that leach into the water, and you're drinking it. So I usually advise a lot of people to you know, be careful of what you're eating, eat organically. The hormones in the meat that they're injecting are also inciting more cancers. So it's a big problem that you need to be more aware of. So I went to Germany to learn different techniques on how to treat cancer other than the chemo, surgery, or radiation. That's all they offer us in the conventional world. And I saw one of my really good friends just shrivel away to nothing from huge amounts of chemo. And she even got a secondary cancer, a lung cancer, on top of the breast cancer she was trying to treat, because chemo is toxins. It's well known that chemotherapy can incite and cause another type of cancer. So I wanted to study, not only for myself, but for the patients that I can help today, to try to get their health back just like I did, and find things that work with the body. Because, you know, our body's a miracle, and if you know what to give the body to help replace the deficiencies, to make it work, help so much more. So what are the first things I do? All my new patients get a Nutri-Eval. A Nutri-Eval is a test that will tell you what your nutrition is intracellularly. What are your amino acids, your vitamins, your minerals, what you're missing. These are important because these are your building blocks. This is what's going to help support your immune system. So it's not just looking at what your, the conventional world will just say, oh, we'll just treat the cancer, we'll rip it out, and then we'll give you chemo, and then we'll give you radiation. It's the wrong approach. You got to change your lifestyle, you know, and it's well shown. You got to see what you're missing, how to optimize your health and optimize your immune system. A lot of cancers have an underlying infection, so we do bioenergetic testing here that will reveal if you have excessive amount of yeast in your system, if you have parasites. A lot of breast cancers are associated with funguses. So that would be important to know, because that's one of the root causes of why you got cancer to begin with. So you need to, and that needs to be addressed and treated. A lot of breast cancers will also incite more acidity. So sodium bicarb IV drips, which is just baking soda, is something that's working with your body to help the body heal. So so when I went to Germany, I learned 2 things that are not prevalent here in the United States. One is ozone. Ozone's O3, and that's what we have in the atmosphere that helps us clean our air. So everybody thinks O3 is pollution, ozone's pollution. No, it's the way you measure pollution. But ozone, when it's given into the body, is antimicrobial, causes a cascade of reactions to help you heal. It boosts up your glutathione. It produces more nitric oxide, will increase circulation. It's antimicrobial, and it won't mess up your gut. So it'll help you kill those bacteria that we're always susceptible to. It helps you kill viruses. And so, when you do that, it's helping boost up your immune system. So it's a good fight for cancer, and especially cancer hates oxygen. And ozone's O3, it'll break down to oxygen. It causes your hemoglobin to release more oxygen into the tissue. So it's a great treatment and it's working with the body, again, to heal. So another treatment that I learned when I went to Germany was the Endo Laser. It's a Weber laser system. This is great. So not only are we polluting our environment, we're staying inside playing on computers, and we're lacking light. Light is healing. All living things needs the light. So the laser, what this does is there's a variety of ways that lasers have been around for a long time, and it's we've used a lot of external lasers, and the laser, when it's put externally, certain lights won't absorb into the skin. Only infrared and red will go absorb into the skin about 6 centimeters. So those are good. So the Germans figured out, well, why don't we do it IV and thread in a fiber optic and bypass the skin and have the power of the laser. So, and now why not put in a breast tumor, put a photosensitizer and then thread a fiber optic right into the breast tumor and shrivel up the cancer the natural way. Now, why does the laser work? Well, infrared helps the mitochondria. Now we go back to cellular biology. The mitochondria helps the energy within the cell. All cancer cells have lower energy within them. And so, and it reverts to what we call anaerobic metabolism. So this is very basic. We've known this for a long time, and we also known that not only do cancer cells resort to anaerobic metabolism, meaning without oxygen, so it hates oxygen, it also feeds with glucose. So it frustrates me when you see in the conventional world, they have donuts in the waiting room. You know, it's like, gosh, this is sending the wrong message. And we know that sugar feeds cancer. We know that. And so why the conventional medical people are ignoring this thing that we've already known from Otto Warburg, who won a Pulitzer Prize because of this, that we're not addressing this. So I think all cancer patients need to change their diet, change their way they're living. And then, so that's one of the holes in the boat that has multiple holes. We got to approach it from all different ways. Another way is you got to relieve your stress. Stress increases cortisol. Cortisol increases sugar, feeds the cancer. Stress, cortisol goes up, your immune system goes down, increases infection, increases cancer. So there's an emotional component to all chronic diseases, and you need to address that because, and so we have a psychologist here, and she's wonderful. We have Liliana does EVOX. EVOX is a computerized system where you speak into it, and it will tell you your subliminal emotions that you stuffed and that hasn't come to the surface. It was amazing because, you know, of course, Dr. Keneally has us do all these different treatments on ourselves. And I'm thinking, I have no emotional problems. I feel great, you know. I go and do the EVOX and I come out there bawling. I'm like, oh, I guess I have a lot of issues I've ignored. And we all do. So you've got to pay attention to the emotional component. You got to pay attention to your diet, got to pay attention to the emotional component, got to relieve your stress. These are all parts of the holes in our boat that we need to plug up. It's not all about just doing chemo and radiation and ignoring those other aspects that have contributed to your chronic illness. So with the laser, with the endo laser, so one, we do it IV, so I thread a fiber optic in the IV. There's 5 lights. There's red. Red light will help relieve inflammation, will help the unclumping of cells. The green light will help oxygen go into the tissues more. The blue light is antimicrobial. The ultraviolet light is antiviral. And then there's yellow light. Yellow light that will help produce more serotonin, boost your vitamin D, and will help you detox. You know, so serotonin is what, when it's low, contributes to depression. So the yellow light will actually, a lot of the Lyme patients that I take care of, even the cancer patients, are like, I want double yellow today because they're happy. It lifts your mood. So, and a natural way, working synergistically with your body. So
we've got some questions.
Oh, great!
So
all right.
Okay, so just make sure to repeat
Sure.
So we have our first question. What does a 26 CRP mean? I believe it's talking about the C-reactive.
Okay. Okay, so there's markers of inflammation in our body. Oh, sorry, forgot to repeat the question. I didn't follow direction. The question was, what does a CRP of 26 mean? Okay, CRP stands for C-reactive protein. C-reactive protein is one of the blood tests that we do to check total body inflammation. Elevated CRP, if it stays chronic, contributes to heart disease. All chronic disease has inflammation, so that definitely is a routine test you always should get. So a CRP of 26 is bad, okay? Sometimes you can get a virus and shoot up your CRP and then it comes back down, and that's okay, it happens to everyone. But you want to repeat that CRP, and you want to know why, get at the root cause. Why are you having total body inflammation? So it could be infection, as I said. It could be because you have an imbalance of your fatty acids. So meaning our SAD diet, the standard American diet, SAD, because most of us don't eat right, is we have too much omega-6s and omega-9s in our diet and not enough omega-3s. And these get metabolized down the same pathway. And if you have an imbalance, you're going to get too much omega-6s and 9s. The pathway goes down and results in inflammation. So we're back to, let's test. Let's get Nutri-Eval. Let's see if our omega-3s and 6s are out of balance. So the other test that will be indicating inflammation is homocysteine. If homocysteine is high, that could mean you're not methylating, so that's another genetic problem. But these are inflammatory markers. They're blood tests. It's CRP, homocysteine, and even a ferritin. That's the one that was way high on me because of my iron storage disease, but it can also be increased with inflammation. So it's an inflammatory markers. Those three inflammatory markers should be tested on everyone once a year. A Nutri-Eval should be done every year. You want to optimize your health. You don't want to change things when you already have disease. Or if you do have disease, you're not going to reverse it unless you address all these issues.
Great. Okay, so we have a couple more questions. We have a question on immunotherapy.
Okay.
So can you just
Yeah, by all means.
About it? Yeah.
Sure. So immunotherapy is a good concept. Now but it's a big word that means a lot because there's a lot of different immunotherapy methods. So what that means a lot of times is trying to stimulate your own body's immune system to attack the cancer. So cancer results because your immune system doesn't know it's supposed to attack it, okay? So here at the clinic, we do what we call SOT. We do dendritic cell vaccine. We also do ATA. Those are immunotherapies that we do. In the conventional world, there's tons of different medications that they say are immunotherapy, but you got to look at the side effects. Some of those have a lot of side effects. They lower your immune system and work against you. So ours works synergistically. So if you do an immunotherapy, you want to optimize your immune system, right? So I would do immunotherapy after I replace my nutritional deficiencies. I've already treated my cancer, but in the meantime, you want to see how to enhance your immune system so the immunotherapy works better.
Great. Okay. I want to go back to.
Sure.
Or if you guys
With LDN kind of.
Okay, yeah. So the question here from one of our patients in the audience said about LDN. What's LDN? LDN is low-dose naltrexone. Naltrexone was actually a medication I used to use to reverse when we gave too much Demerol to the mom. We'd have to give Narcan or naltrexone to the baby to reverse opiates. But we found if we give this in low doses, it augments and helps the immune system. It modulates the immune system, meaning you have two different types. You have cellular immunity, and you also have innate immunity where So your cells produce cytokines to attack things, and then you produce antibodies to attack things. So if you have an imbalance, that's how we result in autoimmune disease. So a lot of my autoimmune diseases patients will go on LDN treatments. And a lot of the cancer patients, it's kind of individualized, but LDN, that's a great question. LDN has helped a lot of patients. It's plugging up one of those holes, you know, in our boat. So I think that may not be for everyone, but that's definitely something that's helped a lot of people.
Perfect. We have one other question on here about just what about stem cells is what the question says.
Well, stem cells you don't do when you have cancer because you don't want to stimulate the bad cells growing. Okay. You treat the disease and then you've got to regenerate the damage that the tissue's done. So I've done embryonic stem cells shouldn't be done. It's been shown to cause tumors, okay? Then there's mesenchymal stem cells derived from umbilical cord, from placentas. So I did that and I didn't see much of a change, but some people see great change. Recently I just did exosomes. Exosomes are messengers of the stem cells. What's great about exosomes, I'm not getting someone else's DNA, which I didn't really like. I'm not getting any viruses, but I have a lot of damage in my body, so I had to do something to keep me going so I can still practice a little bit of medicine and repair the damage that the excessive iron did to myself. So exosomes I loved. Dr. Keneally did exosomes and she had the same results. So exosomes aren't as expensive. You don't have to worry about stem cells clumping together or not surviving the thaw of stem cells. When you do 5 cc's of exosomes, it's equivalent to 455 million stem cells. So I see more promise in exosomes. We started doing exosomes in the clinic probably about 2 months ago. So it's relatively new, but I think there's great promise to exosomes. So it's something to read about and to educate yourself about.
Great. Anyone else in the audience have a question?
Yeah, I do.
Sure.
Okay.
So a lot of people have the xenoestrogen in the body.
Yes. Uh-huh.
Now, after menopause, the doctors want patients to have estrogen because it is declining, right?
Right.
So do you recommend bioidentical estrogen for those people
yes.
with xenoestrogen?
That's a great question. The question was, do I recommend bioidentical hormones to someone who's menopausal, especially when there's so many xenoestrogens in our environment? There's difference. Okay, so it's kind of like you're putting a key in a lock, right? So xenoestrogens, the key goes in the lock, but it's not turning the right way, you know, so it doesn't give you the full effect as bioidentical hormones, okay? And that's same with synthetic hormones. They don't fit in the receptor perfectly like bioidentical hormones. I'm menopausal, and do I take hormones? Yes, I do. And why do I take hormones? Because the only hormone that increases in our body as we get older is cortisol. And cortisol breaks down the body. You know, I need to repair. I need to stay healthy. I want my brain to be sharp. And the bioidentical estrogen, progesterone, and testosterone, you have to take all 3 of those, even if you don't have a uterus, okay? Because they all work synergistically together. And when I got sick, I was just about going into menopause, and I couldn't rebuild my body to get it back until I went on hormones, because hormones are anabolic. They rebuild the body. They help the body. Now, that being said, yes, you have to be careful because you don't want overabundance. You can do urine metabolization of estrogens, and you can see if you're metabolizing down the wrong pathway, like we spoke about. And you can take DIM or I3 supplements to help you go down the right pathway. So I recommend all my patients, all the menopausal patients I treat who take bioidentical hormones, you need to look at the, after being on them for 3 months, you need to look at your, do a urine test or to see metabolizing those estrogens. And I would take DIM or I3C regardless to
you know,
you're at, if you see where your levels are, your estrogen levels are, So the estradiol levels in your blood won't tell you what xenoestrogens you're exposed to, but I can tell you there's a lot of people that are estrogen dominant because of xenoestrogens. They have heavier periods or they get bloated. So, a lot of times I put them on, these are people that are cycling still, then I put them on progesterone to help them counterbalance the xenoestrogen. And I put them on Myomin, I put them on I3C, things that we've already talked about.
So it's best to have a hormone test done.
Yeah, yes, because everybody's individualized, and some people may need testosterone, some people don't, you know. So yeah,
Now,
do a test.
Nutrient, I've done that too. And it only show the toxic levels. There's no hormone.
No, there's no hormones on the Nutri-Eval. So
On
the
the Nutri-Eval.
hormone, but standard blood work should test your hormones. You know, so if you're menopausal and you're on hormones, and you're taking topical hormones, I do salivary testing. You know.
Dr. Shannon, sorry to
Yeah.
interrupt. Do you mind scooting forward a little bit and
Oh.
talking up a little bit more? Just because
Oh.
we can't use the mic anymore. So sorry to everyone who's supposed to hear you.
Yeah. Hi, now we're cozy.
There you go. Nice and cozy now. Perfect.
All right. The questions were about hormones and bioidentical hormones, synthetic hormones, xenoestrogens, and I think we addressed it by people need to be tested. And whenever you take any kind of medication, you always want to weigh the risk benefits, right? And so is hormone replacement good for everyone? No, but it has to be individualized, you know, so did I answer?
So would coffee enema help?
Oh,
For the-
coffee enema is good for liver detox, so that will help. Yeah, absolutely, because your liver needs all its help, because that's how we detoxify, you know, toxins. It has to go through your liver.
But estrogen is made in the liver too, right?
Estrogen's made in it can be broken down to different components. Estrogen's mainly made in the ovaries, you know. So when you're menopausal, you have more estrione. There's 3 different types of estrogen, and so menopausal you tend to have more estrione. Estriol is made from the placenta, so a lot of times the bioidentical hormones are a combination of estradiol and estriol. Okay, so I don't know, we're getting a little off subject, but yeah, that's.
We have a few more questions
sure.
on Facebook. So they can hear me now. Can you
Okay.
explain the different delivery methods for ozone and what is most effective for breast cancer?
Wow, that's a great question. The question was, what are the different methods of ozone and what's best for breast cancer? Okay, ozone you can do ozone vaginally, you can do ozone rectally, you can do ozone to clear out the sinuses, you can do ozone in the ears, and you can do ozone in the IV, okay? So if I had cancer, what would I do? I would do the IV ozone, because you need a higher dose. But I tell all my patients that, you know, a lot of people travel a distance to come to our clinic. I will treat them with IV ozone and give them a big dose, because the dose of ozone you get when you do a 10-pass IV ozone is 140,000. The dose when you do rectal ozone is 8,000. But you can actually do rectal ozone or vaginal ozone at home. You know, you can buy your own ozone generator. There's great websites, trulyheal.com, Simply03. Those are great sites to have you look at the different delivery methods. They have a lot of webinars on their
Great.
website.
Awesome. And then we have another question. What kind of heavy metal testing do you do? Hair or blood?
Oh, that's a great question. So the question was, what kind of heavy metal testing do we do? What we want to do is we got to provoke those heavy metals out of the fat, because that's where we store our heavy metals. The Nutri-Eval does give you your blood heavy metals, but that's not accurate enough. If a lot of my Lyme patients don't get better because they have too many heavy metals. Heavy metals can contribute to cognitive decline, lack of energy. It could be a reason why your immune system is supported. So how do I test? You need to do a provocative heavy metal challenge test and then collect your urine for 9 hours. And that's probably one of the best ways that you can see if you have problems with heavy metals. And if you do, then you need to go through a chelation therapy, because that will definitely help you.
At what point would you, if you're a breast cancer survivor and God forbid it come back, would you consider like mastectomies or anything like that?
That's a great question. Okay, so if you have, the problem is Oh, sorry, didn't repeat the question. Okay, so the question was, if you have breast cancer and God forbid it ends up coming back, how would you treat it? Would you do a mastectomy? Well, if it came back, it's metastatic. So what are you going to do? Keep on chopping off everything? You know, no, it's a systemic disease from the get-go. So from people who says, oh, I did a lumpectomy, I'm cured. No, why'd you get it from you got to go for the root cause. Why'd you get it to begin with? What are your nutritional deficiencies, your lifestyle changes? So if breast cancer came back, what would I do if I were you? Because that's how I treat all my patients. It's what I try to put myself in your situation and tell you what I personally do if I had it. And if I got metastatic breast cancer, I would want to treat it systemically. I'm already changing my diet. I would do the Weber method. So what that is, I would do insulin potentiated photodynamic laser therapy because I'm boosting up the mitochondria. I'm helping the body heal itself, okay? I would also look, do I have heavy metals? Is that disrupting my immune system? Why did this come back? So I do bioenergetic testing to see where the imbalances are in my body, you know? And there's so many different things that I would want to find out. What are my imbalances? What are my nutritional deficiencies? Do I have heavy metals? Is that impairing me to heal? Why to come? Do I have an infection? Do I have parasites? Tons of our cancer patients have parasites. It's pulling down the immune system, and that can be energetically tested also. So that's what I would do.
So we got a couple more questions over
Sure.
here. So what if your breast cancer was hormonal only? Would you recommend bioidentical hormones?
Oh, so the question is, if someone had had breast cancer, would they take bioidentical hormones? No, because you're feeding the breast cancer, right? So no. If you have estrogen receptor positive breast cancer, you do not want to take bioidentical hormones because you're putting fertilizer on the tumor, on the cancer, right? So no.
So what would you do as a hormone replacement if you do have your
Then you
cancer was estrogen and
Sure.
progesterone positive?
Positive. So then you go to herbs and you Don Quai, black cohosh. There's different things and then there's even polypeptides that can help you with those things. There's other things you can do besides something that would incite your cancer.
Great. Okay, and then we have, let's see. So someone mentioned look into myomin to lower your estrogen. How do you like myomin?
Yeah, myomin's great. Yeah, that's what I was telling you guys. I3C, myomin. Myomin's a Chinese herb that blocks the breakdown of testosterone to estrogen. So it's going to help you if you have really heavy periods. It's going to help you, if you're estrogen dominant. Myomin, Chinese herb, good.
Perfect. And then can you repeat the herbs one more time that you mentioned?
Well, there's black cohosh, there's Don Quai, there's valerian root, there's different things that can help you with your hot flashes. There's, I know there's polypeptides that you can do to help. So there's, but then again, you got to look at the whole body. What are you deficient in? Why are you getting more hot flashes than someone else who doesn't? So. What else can I?
Yes. If you are predisposed to breast cancer because of a mother having it, would you consider doing any kind of bioidentical hormone therapy?
That's a great question. Her question is if her mom, if you have a family history, someone in your family has breast cancer, should I take bioidentical hormones? It's going to be an individualized case. It's going to be, how do I feel? The majority of cancers are not genetic, okay? It's very small number. So if I had a mom who had breast cancer, would I take bioidentical hormones? Yeah, because I needed to rebuild my body. And so in my case, I had no choice. I wanted an anabolic hormone to help me rebuild all the damage that the excessive iron did. But it may not be for your case. So you have to say, how do you feel? Do you have brain fog? Are you not functioning? As I said, one of my sisters, she doesn't take any hormones. She feels great. She's doing great. So it's not for everyone. You need to individualize. You need to, but the thinner you are, the more prone you are to osteoporosis. So that's something else you got to consider, because fat people will store more estrogen, and so they don't have to worry about osteoporosis as a thin person. But again, it's individualized, and it's just how the patient feels, and it's bioidentical is not for everyone, and but it sure helped me.
Doesn't estrogen live in fat though?
Yeah, estrione is in the fat, so that's why. Yeah, so someone who's fatter will have more estrogen than someone who's thin. So like, if a fatter person went into menopause, they might not have symptoms like a thinner person.
So we have a couple more questions on here. I'm
Great.
only going to answer, we're going to do 2 more because it's 4:47.
Okay.
So, and then we'll do like 2 more out here.
Yeah.
Okay, so let's do, okay. So someone mentioned, what about hyperbaric therapy?
Hyperbaric therapy is great. Hyperbaric is pressurized oxygen, goes deep into the body. So hyperbaric chambers can treat a variety of illnesses. Cancer hates oxygen, so it's great for cancer. Lyme patients, it drives the spirochete out of the tissues because the spirochete hates oxygen. So it's been great for stroke patients, we need oxygen to live. We need oxygen to repair and to heal. So it definitely plays a role in all chronic diseases. So hyperbaric is a good treatment. It's part of the whole. Yeah, you plug up, right?
Perfect. So then can you talk about CO2 laser surgery for breast cancer?
Wow, I can't really, now, the laser that I'm doing is low-level laser. It's not CO2. When I was an OBGYN, I did use CO2 lasers a lot. I did it more for endometriosis and things like that. So as far as a modality for breast cancer, I haven't had any experience with that, nor have I seen it utilized. So I can't really answer that one.
No worries. Okay, then we'll do just one more from Facebook. Okay, so someone asked, what do you recommend in place of tamoxifen?
Yeah, that's a great question. So tamoxifen is an estrogen blocker that we're kind of talking about, trying to lower the estrogen. The breakdown of the enzyme is aromatase that breaks down testosterone to estrogen. So to block that, they're called aromatase inhibitors. So tamoxifen is the most common one. But I've seen uterine cancer develop in my breast cancer patients who took tamoxifen, because tamoxifen will block the estrogen receptor in the breast tissue, but not in the uterus. So you have to watch for uterine cancer. You have to watch for blood clots. You got to watch for cataracts. So, and again, when you take a drug, you look at the risk-benefit ratio. There's other aromatase inhibitors, blockers that you can take. Now, a mild one that we brought up multiple times is myomin. That's a Chinese herb. Now, there's anastrozole. There's also Femara. Those are estrogen blockers. Those are other ones to consider. Those are medications. So there's other things. Would I take tamoxifen if I had breast cancer? No. I think there's better medications out there with less side effects than tamoxifen.
Great. Okay, so anyone else in the audience? You guys have any questions here? Okay.
You mentioned Femara.
Mm-hmm.
That is a prescription estrogen blocker.
And anastrozole. Yeah.
What are your feelings about
Yeah,
Femara
I think
specifically,
it's
please?
part of the puzzle. Plug up one of those holes, because you're not producing the estrogen that will feed the cancer, right?
Okay.
So yeah, I'm in favor of those.
Anyone else?
No.
I'll throw one in if there's.
What are the side effects of Femara?
Well, Femara, again, it's not as many as tamoxifen. You have to watch clotting, blood clotting. So you got to watch the liver, So, but it's not as you don't have to worry about endometrial cancer and those things.
At
So,
what point would you decide to take one of those if you're?
if you had, so it would depend on your hormone testing, right? So I do hormone testing, I do hormone metabolization. Like in yourself, I would go ahead and see how am I metabolizing my hormones, you know, so to see if there's even a need for that. And they don't do that out there. You know, I'd only take a medication, not, you know, to see if there's a need, you know. So I would recommend you doing the urine hormone metabolization of estrogen test.
Anyone else?
So if you're doing the coffee enema and you cannot hold it, is there any alternative?
Yeah, so you got to decrease your volume. You got to work it up. Decrease the amount that you're using.
I have tried.
I know, it's so hard. I agree. So, what you know, the little Fleets enemas you can get, the little bottles, start with just one bottle of that and see if you can hold that. And you got to work up. But it's, I agree. It's
I
messy.
just wonder whether there's any suppository or anything like that.
You know, a patient, that was a great question. A patient said there was a coffee enema.
Suppository, I've seen on the web.
You know, yes. I don't know. I'll have to ask my mentor, Dr. Keneally, about that. I don't know how much, or if they've studied how much that helps the liver detoxify. So I would have to, I don't know. I'd have to find that. I'll find that out for you and see if I do more research.
So what are the ways you can detox the liver?
So
liver flush, I tried.
Yeah, liver flush. Milk thistle, Silmar. Yeah, that's good. Casserole packs. Yeah, that's casserole packs. Casserole packs will help detox your liver, right?
Yeah.
So glutathione. PK protocol, which is phosphatidylcholine and glutathione and leucovorin, that will help detoxify the liver.
PK what?
Protocol. It's Patricia Kane's protocol. And you can Google it, and it will help. We give it after chemo, low-dose chemo here to help detoxify the liver. Okay?
Great. Anyone else?
What about the master cleanse?
The master cleanse is great because that's opened up all your drainage systems. And so I definitely think it's very important to detoxify because as you're getting cancer treatments, you don't want to recirculate those toxins. You got to make sure all your drainage systems are open. You have to make sure you're moving your lymph. If you're sedentary, you're not moving your lymph, and those toxins are just recirculating. So the vibratory plate will move your lymph. We have lymphatic massages here with the Hemosonic to help move stagnant lymph. So brushing, the brushing. Rebounding, the rebounder is great to move your lymph. Those are all ways to detoxify. Infrared saunas. With the liver, you want methylation support. You want glutathione. Those are you want sulfur. You know, as a way we detoxify. So those are different. And the phase 2 path of liver detoxification, those are things to help support that.
Right?
Now, oral glutathione.
Yeah.
Sorry.
No, that's okay.
Oral glutathione is not as effective.
No, it doesn't absorb real well. If you're going to take oral glutathione, it has to be a liposomal form. But if you can I do, because I had liver damage when I got sick, I do a PK protocol usually once a month. So I'll do
PK protocol.
Yeah, so I do IV glutathione with phosphatidylcholine. It's great. It helps support your body, especially on your Nutri-Eval if your glutathione is low. You need that. Glutathione is a major antioxidant for your brain, helps your liver. You don't want to be low on glutathione.
Great.
Yeah.
Any other questions? We have one more. We have time for one more. We just have 5 minutes.
Juicing for detoxification?
Juicing you have to watch because you're removing the fiber. Are you gonna? So sometimes Dr. Keneally doesn't like you to remove the fiber, but juicing it has a lot. Gets all the good stuff at once. So do I have a juicer? Yes. Do I use my juicer on occasion? Yes. Is that the only thing I do? No. You know, but it's one of the holes. You know.
Great.
All right. Well, thank you. Thank you for listening. And if you have any further questions, you can email them to us or come visit me. Yeah. Okay. Thank you.